Hello and welcome to Business on the Wire. Hospitals across the country, especially in Delhi, Noida, and Gurgaon, are facing an immediate oxygen crisis. There are pleas for help on social media from doctors and hospitals saying they have only a few hours of oxygen left and the lives of patients are now at risk. In fact, in some cases, lives have been lost as well. What has brought things to this point where hospitals seem to be living hand to mouth in terms of the oxygen supply that they need, and what are the critical needs for them at this point? Joining me to talk about that is Dr. Devlina Chakravarty. She's Managing Director at Artemis Medicare Services Limited, one of the very many hospitals that actually had to put out a social media appeal for oxygen, saying they had only about 3 hours worth of O2 left. Thank you, Dr. Chakravarty, for joining in and speaking with me. I want to first talk about the situation at your own hospital, Artemis, and what the supply of oxygen looks like right now, and what sort of outlook you have in terms of how long you have it for.
Thanks for having me on this show. And you must be aware that I had raised some concerns last evening, and I tweeted in the morning. I don't anticipate the situation to change overnight because the situation is of humongous nature, But what good has happened is in the interim, I have seen more logistics coming into operations, like the Army, the Navy, picking up oxygen cylinders, transferring them to destination of choice. So at a hospital level, we pretty much continue to be in more or less the same situation, but we have found our own answers in terms of finding a private supplier. We have arranged for the logistics and we got our supply yesterday night, and we are hoping for a refill tomorrow evening because our oxygen is going to last till tomorrow night. So, but I'm hopeful with, the awareness which is coming in now and which all the movements which is happening, things will improve in the next maybe 4 or 5 days. But in the interim, each one of us will have to help each other, share if we have more oxygen, help out with logistics, and we'll have to do our own thing.
Just to get a sense of what the situation in Artemis is, Dr. Chakravarty, could you walk us through how many COVID patients you have right now, how many are in ICU or do need critical oxygen support?
So, currently we have 62 ventilators deployed. 62 ventilators are the people who are really, really critically ill, and close to 100 more who need high oxygen support. And balance, we are trying to moderate it out. People who are needing, say, less than 4 liters of oxygen, we are trying to give them oxygen on and off so that they can, we can have a judicious deployment of the supply that we have. And having said that, because we had stopped admissions yesterday because of oxygen shortage, today we have a deluge of patients in the emergency wanting beds and wanting oxygen beds. We are managing, and I think all of us are managing. So far, so good. And it's 1 day at a time, but I'm an optimist, and I think, by another week, things should become much smoother, and we should get uninterrupted supply of oxygen, which is actually a dream now, but this is the basic for any hospital to function on.
At this point, you sound like more than an optimist, Dr. Chakravarty. I think it takes superhuman strength to, cope with stress like this. And I think that's the problem for people watching from the outside, to be watching with almost shock and despair.
No, the reason is,
Please go ahead.
See, the point is, there are two things, One is Mitali raising the concern, which I have kept no stone unturned to raise the concern and raise that there is a issue at hand, which I have been doing since yesterday. The second is also to get the panic levels down, because people are, they would die of panic rather than the disease, you see. So we as doctors have to tread this middle path where we will continue to raise the concern. We will continue to say that there is an issue, there is a problem, and we need to do something about it, and nothing can stop us from doing it. And yet we are going to tell people that things are going to be all right, which we genuinely believe, so that the panic goes down. Now, when all the doctors, nurses, administration, politicians, army, Air Force, they all get together, I'm sure there will be a solution. So we have to also not fan the panic, but kind of tell them, hold on, and we will find an answer. Yet today we don't have, and we are trying hard to maintain the balance. That's the message I would like to give to all of us.
Of course. But why has it come to a pass such as this, Dr. Chakravarty, where doctors and people who are overseeing hospitals have to make these kind of pleas for help on social media and literally put down the number of hours that oxygen is available for? I mean, I agree with you. Fanning panic should not be the motive for anyone, but this looks like a plea for help rather than creating panic. What is going on?
Yeah, so the situation, Mitali, is this is an unprecedented situation that we are facing, and there are a couple of reasons. Number one is the second wave. The virus is more infective. So earlier, if one person could infect 3, today they are infecting 30. It's a mutant strain, so it is it's circumventing the antibodies in patients in people who have had the vaccines, and it is more virulent, means it's a little bit more dangerous. So people who are getting the virus are desaturating faster. So earlier we would see somebody at 90 would take days to go down to say 85. Today we are seeing things happening within hours. People are desaturating fast. So there is a bigger requirement for oxygen. So more number of people because of infectivity, and most of them requiring oxygen because of they're desaturating faster. So the combination of these problems is creating a huge demand. Of course, till pandemic is over and till say the government certifies pandemic is now behind us, we have to follow, COVID norms, COVID norms in terms of how aggregating, what are the kind of activities we are doing. That is very, very important, because we had started vaccination, but we didn't put a double tick, say pandemic is over. So we didn't do that. So we had to, and at all levels, whoever it is, wherever we are, we had to follow COVID norms. Now, because somehow, for some reason, people and everybody, I would say across all levels, designations, and really not blaming or anybody in particular, but everybody felt looking at each other, if this is what is happening, it must be safe for me to do the same, So that became a norm. If I see huge crowds gathering in X place, then why can't I have a huge party at home or have a huge wedding for my daughter? So the COVID norms got completely knocked out. So we had not cleared the country of pandemic. We had just started vaccination. So that's where we went wrong in thinking that we are good to go just because we have started vaccination. And what it led to was a second wave which was more virulent, a second wave which was more infective. And in a large population like India, if you have a situation like this, it's mayhem. So that is what has really happened. But having said that, what has happened has happened. My focus is how to contain it. And we have to, pull all stops to contain it. Keep the panic low, but yet keep raising an issue till it is heard and resolved. It's not because we want to sensationalize, but we have to say that we are not losing 1 day, 1 hour in our fight against this virus now. So that currently.
Yet it seems like doctors and hospitals are up against any number of odds, not just, the pandemic itself. I mean, yesterday you talked about the shortage and the fact that supply was running short. And then there was a response from the district drugs controller saying there's adequate oxygen in supply. I don't know why hospitals have to take to social media. Equally, on the 21st of April, we have Max Hospitals moving court, asking for oxygen, failing which their patients might actually lose their lives. Why are hospitals in this desperate situation where they're almost up against the wall fighting not just the pandemic, but fighting systems and processes as well?
Mitali, you know what? I'm a doctor. And when I was in medical school, I've been taught one thing, that you have to diagnose a problem to be able to solve it, and that is the beginning of solving a problem. So if we, and I think a lot of this complacency is going away, and our job is to diagnose the problem, tell that there is a problem. So now I don't want to get into who is saying what, but and we are happy to put our head down and do our job. The fact that if we are speaking up is because we are saying that there is a problem, and solve it. I mean, it's as and with due respect, and I think the administration is also chipping in the best that they're trying to do as much as they can. But there is very little currently they can do. The designated supplies, bigger logistics are brought into play, which is thankfully people are airlifting, which is there are surface transports which are like one should not getting complacent. But our job is to keep raising the red flag, because we are happy to put our head down and do our job. But why would we say it if unless there is an issue?
Absolutely. I mean, that's what I'm trying to get to, because what's also happened on the flip side is more and more critiques saying, hospitals are creating panic. They are, quote unquote, wasting oxygen. There has been any number of data that has been quoted in terms of, what India's oxygen supply is, the fact that it's well within its limits. How do you take on and respond to to that kind of criticism?
No, actually, criticism doesn't affect me. Lives do, Saving lives makes the biggest difference to me. There's a lot of times there are kind of half-baked information and things go out. It doesn't bother me, because today we are getting 1/3 of our supply compared to what we were getting in normal times. Our demand has gone up by 3 to 5 times. Yeah. So that itself gives you an idea about a demand and supply. In terms of hospital, and I can talk about my hospital, we are doing everything possible to optimize the oxygen use. For instance, there used to be things called high flow nasal cannulas, which is to use a lot of oxygen. We have stopped using it, and we are electively ventilating patients because that takes up less oxygen. People whom we used to keep at 93, 94 oxygen saturation on the oxygen beds, we are now keeping them at 88, so that we are able to optimize it. If you see, a lot of times you put on a mask and the oxygen is getting wasted from the side. You can see hawa side se nikalta hua. So we have added a reservoir so that whatever goes out comes back into the reservoir and goes back. So for us, oxygen is life, and we won't say unless it is required. So because for me, every patient who is with me in the hospital is my responsibility, and anything untoward, it's my responsibility. So I will have to make sure that whatever it takes, we get our supply and we treat our patients. So I rather not get into any controversy or any criticism, because that's not my job. My job is to look after each and every patient who comes to me and ensure the death rates are down, the morbidities are down, and people can go back home safe and sound. And that's my job. And that's what I'll focus on.
And that's what healthcare workers have done an incredible job at, ma'am, over the last couple of years, ever since COVID.
Thank you.
I don't even want to second guess you, but there are some experts who indicate that in the coming weeks, we're looking at a trebling of infections. You're right there and you're seeing what's happening. What do you expect to see in terms of, a fresh influx of patients, a fresh influx of infections? And what do you think that's going to do in terms of demand for oxygen for hospitals such as yours?
So the possibility remains high that the numbers may increase. But like I said, because again, today, currently, everybody has gotten careful about this disease. Nobody is once again taking it lightly. I am also hoping that we may be able to stabilize. So it could go either way. We stabilize at this level, or we continue to increase the numbers. Both are at a 50-50% chance. Now with the logistic teams from the government coming into play, whether it is Air Force, whether it is the Army, I think things can move much faster. Every corporate has come forward. The steel manufacturers, people dealing with, metal welding industry, they have all come forward. They have stopped their supply to their plants, and they are happy to divert it to the hospital. So this is going to be a effort from all sectors, from each one of us. And if at least people of India start following COVID appropriate behavior, and I think now they have understood the enormity of the problem. They've gone back home. They're not going out unnecessarily. They are not being, foolhardy about things. So a combination of people being aware of the problem, more oxygen mobilization happening across the country, and the support of corporates, government, administrator, I think we will have a control on it. We may not be able to completely put a lid on it, but we may be able to have some kind of a control on the situation. But that only maybe in a few days from now, we will have a clearer picture. Which way are we going?
The numbers seem to indicate that the demand and supply situation has left the Delhi and NCR hospitals more vulnerable. What do you think the reason for that is? Are there more critical care units in this area? Is access into Delhi more of a problem, or has it been a planning problem for Delhi NCR specifically?
No, the thing is, one is the cases are highest in Delhi NCR compared to a lot of other states. Then indigenous oxygen production plants are very few. And if you look at Delhi, Haryana, UP, areas, so they're much further off. And some of the largest hospitals, this is the hub of all big super specialty hospitals. So it is a combination of all these factors which has led to a huge surge of patients and a decrease in the supply.
I noticed also that you made a comment saying we have stopped chasing the lack of remdesivir or ventilators. We're just asking for the basic uninterrupted supply of oxygen. And I find this a heart-rending plea, because really the first and last line of defense is oxygen. What is the situation, ma'am, in terms of, other equipment or other facilities or medical supplies that hospitals need right now?
Mitali, everything else can be managed if you get oxygen uninterrupted. A ventilator is of no use if there is no oxygen. A bed is of no use if there is no oxygen. And currently there is no drug which is like a foolproof treatment of COVID-19. Drugs like remdesivir, tocilizumab are being used, sometimes as a salvage medication, but it's not a magic drug that if you give it, the patient will be saved. But of course, if you get without oxygen, you cannot, treat this pandemic. So instead of my idea was, instead of focusing on too many problems at one point, others which are of a lesser nature, others which are not that life-saving, one should focus on one key problem at one time, so that we are not stretching the administration, the machinery, and saying, give us oxygen, give us remdesivir, give us ventilators, so let us focus on what is our priority and what we need maximum. Rest will take care, but just give us this, stay on one point program, one issue, and provide us this, rest will manage. So because we also have to put our best foot forward and try and see, not keep asking, we don't have this and that and so on and so forth. So just give us one, and the balance will manage is what I'm trying to say.
Just one final question, Doctor. We've seen COVID waves across the world over the last year and a half, and we have seen situations of ICUs, running over, beds falling short. But I cannot recall another nation struggling this way for oxygen. I'm just trying to understand how the doctors and the nurses and the medical staff are trying to hold their morale together at a time like this, when they know that there's probably worse coming with the peak.
The thing is, every country had their own challenges, be the NHS in UK, the United States, they have had their own challenges, because sometimes it was a people behavior, sometimes it was a policy decision which was not COVID appropriate. The challenges were, they were huge at all points. Our challenge is unique because we have this huge population which migrates seamlessly from one state to another, and then this virus, which has now, have multiple mutations, and which is jumping everything that you are doing, and is also hugely infective. But let me tell you, the doctors are very, very resilient in our system. I think they're far more resilient. I have been trained in India and abroad, so I have seen the doctors in India, because the type of patients they see, the volume of patients they see, the infrastructure under which they work, they are far, far more resilient than I have seen doctors across the globe. So for them, every challenge is a new day, and they find ways to handle it. Of course, there is huge amount of fatigue which is setting in, and I don't replay that. Doctors are working round the clock, and so it is job of people like me to make sure that we get uninterrupted supply. I'm not telling my doctors, the frontliners, to worry about oxygen. I'm only telling them to audit, do judicial use. But there is no panic, or they know that we will get it somehow or the other, and that's my job to make sure how we get it. But in terms of resilience, I think Indian doctors, the way they can work, and in all kind of odds and in all kind of infrastructure setting, I don't think doctors in anywhere in the world can match up to us. So it's a this I think my team is on ground. They have not even blinked once, and they have just followed instructions to the T. If we say, optimize oxygen use, no questions asked, they just optimize it. But then their focus is looking at hundreds and hundreds and hundreds of patients every day. And then I say, okay, can take more patients, take more patients. That's all. They are just like, our very, very resilient Indian Army, who just go out and do the job. So this is what they're doing on the ground, and it's hats off holding the situation together.
Indeed. And may they never be tested this way again, as they have been in the last couple of years. Thank you so much. I know time is of essence for you, but I really appreciate you taking time out and speaking with me, Doctor. Thank you.
Thank you very much.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.